Chapter 27, Organic Stricture of the Urethra, Etiology, Pathology, Symptoms, Results, Diagnosis. Although two conditions commonly known as stricture have been described in the preceding chapter, the one, spasmodic stricture, is a mere symptom, and the other, congenital stricture, a condition which, except in extreme cases, is absolutely innocuous. Organic stricture, the stricture that is never innocuous and always active in its work of undermining its possessor's health, except when kept at bay by the surgeon's efforts, has yet to be considered. True organic stricture of the urethra is a cicatrix of the urethral wall left there by some injury or inflammation, and manifesting a constant tendency to contract and thus to diminish the lumen of the urethra. This tendency to contraction, which is always manifested in a greater or less degree, is doubtless caused by the irritation incident to micturition, the impact of the stream against the barrier. For the deepest stricture, the one that most obstructs the flow of urine, is almost always the tightest. And if the stricture is kept dilated so as to afford little or no obstruction, the tendency to recontraction is slight. Stricture occurs in the female as well as in the male urethra, but this lesion in the female is much less common than in the male and manifests no distinguishing peculiarities, either in pathology, symptoms, diagnosis, or treatment. Oberlander very properly refused to recognize any pathological distinction between chronic anterior urethritis and stricture. The pathological difference is only one of degree, but the clinical distinction is clear. Infiltrations larger than 26 French are readily cured by dilatation and show but a very slight tendency either to relapse or to contract. But infiltrations tighter than 26 French show a marked tendency to contract progressively and require the treatment described in the ensuing pages to cure or even to control them.